President Obama and Democrats insist that health care reform will not include illegal and undocumented immigrants, but many disagree, citing a loophole that there's no requirement for verifying citizenship included in the current House bill. So could immigration derail health care reform? Let's bring in Mark Krikorian, Executive Director at the Center for Immigration Studies. We also have Rob Shapiro, former Undersecretary of Commerce under President Clinton. Thanks so much for joining us, gentlemen.
Pleasure to be here.
Rob, let me start with you. Are they included or not, and what does it mean for the likelihood of getting this by?
Well, let me say, this is really a textbook case of a phony issue. The administration, the Democratic leadership, the Republican leadership have all agreed that the provisions of health care reform will not be available to undocumented workers. This is another kind of proxy issue to get at the immigration issue, but it's really not about health care. Now, the fact is that in the United States, we don't deny emergency health care to anyone. So undocumented people will be able to show up at hospitals after health care reform as they can today.
Mark, do you agree with that?
Most of it, no. The fact is, this is all of the claims that illegal immigrants won't benefit from this program are simply false, and the Democrats in Congress know it's false, because even though it says illegal immigrants won't benefit from the insurance premium subsidy, that's the question here, an effort to introduce an amendment that would require verification was voted down on party line basis. So the fact is, it's even more important, I think, that as far as the political prospects of the bill, is not so much that illegal immigrants will benefit, because they will. It's the dishonesty of claiming to the public that illegal immigrants won't benefit while winking and nodding to the supporters of illegal immigration, making clear that illegal immigrants will, in fact, not be checked, so they will be able to sign up.
You made your point. Rob Shapiro, what about nailing down the verification issue? Because I think Mark is correct. It has not been fully resolved. Now, the president has tried to stomp on this, but in the legislation itself, it's all very vague.
Well, the fact is, verification, the United States doesn't have a system of identity cards for citizenship. We never have. The only proof of citizenship that we have are passports, and less than half the country have passports, and birth certificates. And most people don't have their birth certificates. This is properly an issue for immigration reform, not for health care reform.
I understand, but unfortunately one walks into the other, which is a big point. What do you got? 6 or 8 million, and you have their children, and you have the cost to the emergency room and whatnot. So, Rob, you're kind of, my friend, you're not really directly addressing this.
Yes, I am. I'm trying to address health care reform. The fact is,
no, but I'm talking
before health care reform, wait a minute, Larry. Before health care reform and after health care reform, we don't deny anyone emergency treatment. That's not going to change at the hospital. The question is, if
Larry,
there is some provision for insurance, when you register for it, do you have to make this proof?
Mark, go ahead and respond.
Excuse me, guys. There actually is a verification system. It's called the SAVE system, which is already used for all kinds of government welfare programs. The question is not, is the person a citizen? The question is the person legally in the United States, citizen or a legal non-citizen? And there is already a program that's been used for years and years and years for determining whether a person is eligible for these kind of services. In other words, whether they're legally in the United States. And the Democrats in Congress specifically rejected an effort to include this subsidy into that system. They know what they're doing.
Okay, Rob, real quick, last word.
What I'd like to ask the other guest and all these other opponents, if that was accepted, would you then support health care reform?
I don't do health care. I do immigration.
Yeah,
all right, we're going to leave it there. Thanks for joining us. I think Larry's saying no, but
good place to leave it.
It's unclear.
It's another